So this is how you need to evaluate for the hypothyroidism, and this is a table which is directly given in the Harrison. So first and foremost, like what you need to do is you need to measure the thyroid stimulating hormone. And once you measure the thyroid stimulating hormone, you need to check for whether it is elevated or whether it is normal. If the thyroid stimulating hormone levels are being elevated, then you need to check for immediately the unbound T4, which is nothing but the free T4. If the free T4 levels are low, that is suggestive of your primary hypothyroidism. And you need to check for what is the cause of primary hypothyroidism. It is like autoimmune or is it like non-autoimmune, for which you need to check the thyroid peroxidase antibodies. If thyroid peroxidase antibodies are positive, then it is autoimmune hypothyroidism where you need to give thyroxine treatment. If thyroid peroxidase antibodies are negative, then rule out what are the other causes for the primary hypothyroidism. So that is one lineup where the free T4 levels are low. If the measured TSH is high, but the free T4 levels are normal, where can it happen is, that can happen in case of the mild form of hypothyroidism. So in case of mild form of hypothyroidism, like there will be compensatory increase in your TSH, but the T4 levels will try to get maintained normal. And immediately you check for the antibodies. If the antibodies are positive, then it is considered to be autoimmune. You need to consider for thyroxine treatment. If the antibodies are negative and if the individual is asymptomatic, you need to just do annual follow-up. So that is what, like when the TSH levels are elevated. If the TSH levels are normal, then you suspect either pituitary or the hypothalamic disorder. And if you are suspecting pituitary disease, then you need to measure the free T4. If the free T4 levels are low, then in such case, rule out the drug effect, CQ thyroid syndrome, then evaluate the anterior pituitary function. If the free T4 levels are normal, further testing is not required. When TSH is like normal, free T4 is normal, further testing is not required. And if there is no pituitary disorder being suspected and the TSH levels are normal, no further testing is required. So further testing is required only if the free T4 levels are low with normal TSH. So this is about like overall workup for your primary hypothyroidism and secondary hypothyroidism. Now let me just try to elaborate this table in detail. So first and foremost, you need to check for the TSH. If the individual is having the normal TSH levels, that will exclude which form of hypothyroidism? That will exclude the primary hypothyroidism. Because in primary hypothyroidism, it is always increase in the TSH, it is not the normal TSH levels. But the normal TSH level will not rule out secondary hypothyroidism, but it will only rule out or exclude the primary hypothyroidism. If the TSH levels are elevated, along with that, if there is free or unbound T4 levels, once the TSH level is elevated, then what is the next step? You need to check for the free T4 levels. Why? Mainly to confirm the presence of the hypothyroidism. If the T4 levels are low, that tells it is the primary hypothyroidism, no doubt in that. But remember, assessment of your T4 levels, they are considered to be inferior to the assessment of the TSH levels. Okay, so the best test to analyze the thyroid related disorder will be the TSH. So TSH is the one which is used as a screening test. And why T4 is inferior? Because the assessment of the T4 will not detect the presence of, the subclinical hypothyroidism, will not detect the presence of the subclinical hypothyroidism. So that is the reason why assessment of your free T4 levels, they are inferior to compared to that of the TSH. Whereas in case of subclinical hypothyroidism, the TSH level is being elevated. So overall, what I mean to say is, if the TSH level is elevated, then the next step is you need to check for the T4. If the T4 levels are reduced, it is suggestive of your clinical hypothyroidism. And the T4 level assessment, it is slightly inferior to compare to that of TSH, because the free T4 levels will not detect the subclinical hypothyroidism, because in subclinical hypothyroidism, the T4 levels may be normal, but the TSH levels will be elevated. Then what about the role of the free T3 levels? Remember, the free T3 levels, they are normal in almost 25% of patients with hypothyroidism. So that is the reason why, in spite of the presence of the hypothyroidism, the free T3 levels may be normal. Why? Because the T4 is being converted into T3 in case of the severe forms of hypothyroidism. So the T4 reserve will be reduced, but T3 will remain normal. So that is the reason why in 25% of patients with hypothyroidism, free T3 levels, they may appear normal. That is the reason why measurement of your T3, it is not indicated. Right? Measurement of this T3, it is not indicated. Then the another important is the subclinical hypothyroidism. So once clinical hypothyroidism or subclinical hypothyroidism is being confirmed, the etiology is usually easily established, right? So for assessment of the etiology, what is that you need to know? You need to do the levels of the TPO antibodies, and you need to do the assessment of the thyroglobulin antibodies. The TPO antibodies and thyroglobulin antibodies, they are present in almost more than 95% of patients with the Hashimoto's thyroiditis. So once you make out the hypothyroidism, the next thing is you should be able to assess what is the cause of that hypothyroidism. That you will be able to make out by assessing the antibodies, that is TPO and thyroglobulin antibodies, which are present in more than 95% of patients.